twist it and pull the gray off, and it exposes a gray rubber sheath. If I pull this sheath back, what do you see?
Needle.
A needle. It's a double-sided needle. Do not touch the gray sheath. You will get stuck. Then we need a needle holder, and we screw this in. Okay? Rainbow, there's our needle. It is about 1 inch long. It's exactly 1 inch long. And we're going to embed that into the skin about halfway. It varies according to how heavy the person is, how deep the veins are. If they exercise a whole bunch, their veins protrude, if they lift weights. So we have to make adjustments. But generally speaking, I want you to learn to go halfway in, okay? And then when we come out, the first thing we do is close that and drop it in our...
How did you close it?
It's just knock it against the tray. Do not use your finger to close it, okay? Tray or table or whatever, and then you drop it in the sharps container, okay? So, once again, we're going to twist the gray part off. We're going to screw it into a needle holder. Make sure it's tight. Righty-tighty, lefty-loosey, okay? Then we're gonna have a tube. Excuse me, this is a vacuum container, okay? It's called a vacutainer. I'll write that down for you. And so when we get into the blood, when we get into the vein, there's pressure in this tube and it's going to suck the blood right out. That's a good one. Let's try tying tourniquets around our head.
No, it was more like a headband. Use it for a
So when we're getting ready to set up, I want you to have a tube, and we're not going to push it onto that needle. We're not going to engage it. We're just going to leave it in the needle holder, okay? So I need to have that. Now, I also want to have a cotton ball when I come out, and I also want to have an extra tube just in case the vacuum is gone. If somebody pulls a tube and they've engaged it into the needle and they put it back by mistake, sometimes the vacuum's gone. So we always want a backup tube and we want a cotton ball when we come out, okay? Then we're going to, it's nice to tie your tourniquet and palpate your veins. Okay, on the Manikin you can feel them pretty good. You can see them actually too. And you can see all the needle holes. Okay, so I'm going to put my gloves on, if I can. I'm a trained professional, I can do
You
this.
find the vein, then you put your glove.
Well, it's easier sometimes while you're learning to palpate, okay? So there again, you want to push down, and it's going to feel soft and spongy. It's going to be bouncy. If you feel hard and solid, that's probably a little ligament or a tendon. That's not what we want. We definitely want soft and spongy. Another way to feel for it is if you rub your fingers this way, you can feel the bump, okay? So there again, the whole point of the tourniquet is to help you palpate the vein. That's the simple purpose for that, okay? Once you get that tourniquet on, that's when you'll palpate. To do it before you get a tourniquet on is a waste of time, really. So put the tourniquet on, palpate your vein, make a decision, right or wrong.
You only have 1 minute.
You have 1 minute to leave that tourniquet on, right? We're going to clean the area in a circular motion towards the periphery. Put that on my trash, okay? Going to rainbow off my needle cover. Make sure I'm bevel up. This may be in the way. You may have to adjust this. You can do that. I'm going to hold it with my 2 fingers on this needle holder and kind of the 3rd finger on the tube, okay? I'm going to anchor the vein. I'm going to touch it to the skin, okay? Especially if you're a little shaky. By just touching the skin, it will stop the shakes, okay? I'm going to take a breath, and as I exhale, I'm going to do a little stick. He didn't stick very good. Let's go another vein. Okay, that one's a little bit better. Okay, so I've got about half of the needle in.
Can we come over there?
Sure, absolutely. We're going to do this in person. I just thought I'd give you a one-time lecture. And then my fingers are anchored to the arm because I don't want to go in and out, okay? So by anchoring my fingers on the arm, I'm holding my needle steady. And this is what you're going to look at the whole time, is that point of entry. I don't want to see this. I don't want to see this, and I don't want to see this, okay? So we want to hold that needle really still. That's the whole key. Then we have flanges on the needle holder. They're for a purpose, okay? We're going to grab them and push that in, okay? And then I can push against it and pull it out. All the time holding the needle steady.
So pushing it in is when the blood, you push it in and then the blood just comes out.
Exactly, exactly. All right. Then we may have to change tubes. We may have to draw 5 or 6 tubes. Can you imagine?
I never watch when I take my blood side.
And most people don't, which is a good thing. Okay, then we're done. Tourniquet, tube, and cotton ball. Now I don't press down on that cotton ball until I come out. I close my needle and I drop my syringe. Okay, so that's why I'm saying there's an order that we have to do this in for safety. And then I have the patient, you know, if I have to take a step, hold the cotton please, keep some pressure on there, and I'll step and get rid of my syringe. Closing that needle is the most important thing you guys can ever do, okay? God, these gloves are hot. Whoa.